So welcome everyone to today's session on how to make your health workplace sustainable. Or actually, I learned this new phrase. It's like climate smart healthcare, right? That was a pretty good one. Anyway, today I think at least I've been struggling, but I am actually really excited for today's presentation because we have three amazing women who have been making changes in their workplace against all odds. And they are here to share what they've been able to do, what they've been able to accomplish. And I'm just so in awe. So I'm really grateful for all of you for attending today. And I'm really excited to hear from Lori and Debbie and Hillary today as well. We'll have a little short panel discussion after they give their presentations about what they've been able to do in their workplaces. And then we'll hopefully have a little bit of time for Q&A at the end. All right, so without further ado, I would love to introduce Dr. Lelakia. I think I actually realized I just don't know how to pronounce it.
That's right.
Okay, perfect. And she has been able to do so much in at Stanford as well as at Santa Clara. And so I would love for Lori, if you could get started, then we can
Yep,
progress. Just let me know
absolutely.
if you want the slides to progress, okay?
Great. Um, yep, I have a few slides to talk about some of what I've been up to, and I wanted to frame it by saying I haven't been at this very long, and it's been a slow build. So I completely believe that people can start where they are and make a difference. Next slide. Yes, start where you can and try. And by that, I mean, push your boundaries a little outside of your comfort zone. And then hopefully you'll find that as your comfort zone will expand and you can take another step. I think in part of this adventure, it's super important to build interest, to provide education to your work unit and beyond your work unit to help get this to snowball more. And for context, this was a slide from my very first climate talk, which was 2 years ago. And it was a grand total of 5 slides, but it was scary the first time, but it helped to build things from there. Next, please. So I like this Venn diagram from Ayanna Elizabeth Johnson, who's not in medicine, but I think it's very apt. What makes sense for you? And so your climate action, it's not a one size fits all. I had been looking for how can I contribute. I'm not going to be in politics. I'm not a typical, show up at rally kind of a person. I'm not a climate scientist, but what can I do? And so I draw on who I am and what my networks are. So that's a division chief for otolaryngology, a surgeon. I have an outpatient clinic. I'm an educator. I work at a safety net hospital. And so that forms part of helping me to fill out this Venn diagram, what resources I have, what networks, what skills, what needs doing, and what brings me satisfaction. And I chose several of those things and just tried to push out from there. So this is, the very first things I did back in February 2023. These are slides that I just lifted from a talk that I gave to the Department of Surgery about some QI things. One of those QI things was an advocacy grassroots program to try to get our institution to sign the Department of HHS Health Sector Sustainability Pledge. Started up with giving some grand rounds, and I have these asterisks after the APP grand rounds because that actually gained a couple of nursing colleagues that really became very dedicated to this cause and helped to amplify what I could do as just one person. Next, please. In clinic initiatives, the first things I did, they weren't a whole lot. We used to use these plastic kidney basins when we would we put some niacin and lidocaine onto nasal plugets, and we would use this kidney basin to do it. The plugets are quite small, and the change was to use a paper cup instead. And we used to use these plastic lined paper on our exam tables, and the change was, let's not use them. And because these things were in my power as a division chief, those were pretty easy. And we started turning off some of our equipment lights at the end of the day. And then we had an initiative that we're not going to default print our after visit summary. We're going to give patients an option. Do you want it printed or not? These things that I listed as in progress in 2023, I put an asterisk there to remind me to say that this putting the exam room monitors to sleep, that is only now just piloting. I think it's a worthy project, and that every single exam room computer in our entire building and throughout our system never go to sleep at night. But this required going through IT, of course, and it has taken now nearly 2 years to get to a pilot where we're trying 10 computers on my floor. All right, next slide, please. So not everything is easy, and some things have to be revamped or even abandoned. This slide is to say, find your allies, and try to get them to engage. I think that requires inspiring people and making it seem like this is a cause that is a positive cause, that we can actually have some influence, something that they want to do together. So in part, it's being a cheerleader and a proselytizer, a preacher. But in my view, that's part of what it takes to get these things going. And the message basically is these three things: climate change is a health problem, healthcare emissions and waste worsen climate change and threaten the health of our patients, and I'm at a safety net, so that's an important message. Our patients here, our families and our communities. And then the third part is we can do something about it together as a team. So this idea of empowering and team building, the Save the World message, the Save Money message, I think is a more positive message for administration. To me, it doesn't really matter if I'm saving 5 cents on a glove. And I think for most people who work in healthcare, they're maybe more aligned with the Save the World message. And then just understand you're not getting everybody engaged. And this is something that Bill Pevick mentioned to me, way back when I gave my first 5-slide talk, that people are going to tell you that your talk was great, and hardly anybody's going to step forward. So just understand that. And those people who do step forward, build from there. I think in terms of project choice, what's feasible, there's some things that, like I had this idea, we have disposable curtains throughout our entire hospital and all our exam rooms. And that's, I did the research, how much money, how much waste, but it just couldn't go anywhere because it just seems that logistically it was going to be too hard. We'd have to buy so many cloth curtains, and we'd have to buy, 3 times as many as we'd need, so we could have some in the laundry, which is 4 hours away from us, and some in the truck. And it just seemed like that was going to be too tall of a mountain to climb to get buy-in for that. So some things you just have to leave off. And then I want to just mention about and who should be on the team. I think nursing, super important. Infection prevention, super, super important if you're doing anything that, might have any patient safety, infection control kind of a thing. And just rather than coming up against, it's better to have them with you, to be brainstorming solutions from the get-go. And environmental services also super important. And one example there is, we had this brilliant idea one afternoon. We're going to change the position of our red bag waste bins. We're going to put them in the back of the room, and that way it's going to be more intentional for people to figure out, this is red, I'm going to walk to the back of the room to put my waste in, and that's going to really help us to reduce the erroneous use of that bin. And of course, we came back in the morning and environmental services had moved everything back into the same position as before. Like how silly that we didn't think to involve them, but those are some of the lessons learned. Next, please. These projects are on the ambulatory side and are some of the things that I've been working on. I also work on things in the operating room. I'm part of a group on sustainable purchasing, and one of the things we're working on there is compliance with SB 1383, including recycled content for toilet paper and recycled content for paper towels. So this is, starting from zero, you do 3 things and you push on this and you push on that and you see what you can move. Hopefully, by celebrating those successes and building your own personal expertise plus those around you, some of these projects can amplify. Some projects are not going to work out, but the do what you can message that Shun mentioned at the beginning, I think is where we need to keep our focus. With that said, I can talk about any of these more at the end if anybody wants to hear more about them, but I'm going to use the Use Gloves Wisely project as the example of one of the projects we've done. Next, please. So this is actually taken as a presentation that I gave on this project. So we had a outpatient project in a couple of our clinics here on our clinic side between plastics and ENT. But then in summarizing that project, this was a presentation that I gave to one of our inpatient units to help launch their project. Next, please. So setting up the frame is important. The sort of the call to arms is, why is this important at all? And in any QI project, it's important to be setting the problem as, why should we care? So, this is sort of the things that most of us know about healthcare is so impactful in terms of greenhouse gas emissions. They have public health harms, and our facility now has taken that pledge. Next, please. Also in terms of frames, why do we care? Because plastic is terrible. And so I've listed here some of those plastic facts, that only 9% of plastics ever produced has been recycled, shocking. That plastics go to microplastics and they are now everywhere. And that the disease burden attributable to plastic has been measured, and it's a lot. Next, please. So again, why it's important, because reducing single-use plastics is important for us to reach our commitment to the pledge to reduce emissions. It's also important to keep ourselves and our patients healthy and safe. Why are we choosing gloves? Because look at that. They are the highest volume disposable product purchased by healthcare, which makes sense. We all use gloves throughout the entire organization. Nationally, 100 billion. In our organization, which is a 3-hospital organization with associated clinics, 41 million in 1 year. And those are the non-sterile nitrile gloves. And here's the amount of waste. Wow. If we convert that into carbon emissions, that's a super big wow. And so this is getting people excited or understanding why they should do this thing. No one really cares about the 5 cents per glove or 10 cents per glove. They care about these kinds of numbers. Next, please. So as part of the project, of course, we look at what are the existing standard precautions policies around gloves and hand hygiene. And, part of this as well is We are not talking about cutting corners. We're not talking about risking provider, healthcare worker safety or patient safety. We are following the rules here. Those rules are based on recommendations from the Joint Commission and from the CDC and from WHO. Next. Next one, yeah. And then just to summarize, okay, here's when, everybody, that we're not using them for general protection. We're using them for these specific indications. And a lot of this is in many quality improvement projects, a part of the intervention is education. Like, gosh, I just didn't know that these are the reasons why. Next. Here's some other facts about glove use, things like wearing gloves can lead to cross-contamination. They can give a false sense of security. They can, your hands are still contaminated 30% of the time. That bacterial counts when you use gloves compared to when you hand hygiene your hands, that bacterial count is equal. So doing some of the background to that actually the WHO has already done for us, that hand hygiene remains the most effective measure to prevent transmission and infection. Next. So that's providing some assurance to the audience that we are just going to be following the guidelines that are evidence-based, that everyone can agree on. This was our goal. Next. We made this poster about times when you need to don't have to wear gloves. Next. Here are the results from that initial project. So we were able to reduce gloves per visit by 27%, which is great. That annualizes, if we project it over a year, almost 60,000 gloves. We're not suggesting that we're not going to wear gloves. We are initially, this project actually was named Gloves Off Campaign, but that is kind of a negative connotation. We're framing it as use gloves wisely. That, yep, we all use gloves. Yep, we are all going to be wise, and we're going to understand how to do better with that. Next. Yeah, just a summary on some of the impacts. Next one. This was a little bit of informal feedback that we got from that first group. Things like, it feels really good to be reducing waste. And I never knew we used so many. And it feels great to be stopping and thinking, do I need to use gloves for this? That people said, I'm using my hand hygiene much better now because I'm doing it right in front of the patient. And then people said, not wearing gloves shows that I'm not afraid to touch the patient, that I accept them, and I regard that as part of my healthcare practice. Next. And then in terms of our larger organization, if we were successful at getting a 15% reduction, that would be a fair amount of money, but it would also be equivalent to taking 38 cars off the road. Yeah, so the message here is, let's do what we can together to keep our patients and our community healthy and safe. Next. This was the rollout to that unit. This is currently an ongoing project in our acute rehab. And we went through, here who are the stakeholders, here are the champions on your unit and that are supporting your unit, what the project is going to entail, including developing task and unit specific guidance. We actually chose one of the people in the room, nurse on the day shift, a fairly senior nurse who had all kinds of objections. We chose him to be part of the group that would decide on that unit specific guidance because it's important to include those opinions. I shared with them that we have this Use Gloves Wisely video, which our outpatient staff really, really wanted to make and made me be in it, which was a little not exactly what I signed up for, but now it's part of our educational materials. Next. This is the unit-specific guidance for the rehab unit where we had set up sort of the basic poster and the basic recommendations, on for wet, off for dry. and they wanted more specific language around mobility and transport, and they wanted to put in about things like it's okay to handle monitoring cables and devices without gloves. Anyway, I think it was helpful to have them be part of the what's going to be the right thing for you and your unit. Next. I think that's the last slide. I use this warrior to warrior. This was like in one of my earlier talks, because I am a climate warrior, and it feels better to be a warrior as best you can. I think sustainability progress is not a straight line. Detours, dead ends, hurdles, some of which you can get over and some of which you can't. But the overall message is to grow your allies, try to develop and empower others. And one of my hardest workers here on my outpatient side is an assistant nurse manager who has subsequently gotten promoted, and she came to and out of my unit, which is a loss to me. But she said, you know, having me involved in these projects really made me think I could do these things. And thank you so much. You know, my courage to apply for this promotion and to take some of these skills to a different site in our organization. It's all down to you having faith in me, which, you know, is just so awesome. Consider your stakeholders, like don't forget infection prevention, don't forget EBS if you're doing a project like that. Start with your smaller project, pilot projects. And I think it's helpful always to term things as a pilot, instead of saying we're going to change what we do all across our operating room. How about we just pilot it in, you know, these 2 rooms and see how it goes, and people can get on board with that more. So small steps. Make sure to be shouting out all your successes to let others hopefully opt in. And then this message in being from warrior to warrior, that going greener together feels good. And I think that's a good message for today as well, that, you know, it didn't turn out as we wanted yesterday, but what can we do? You know, what we need to do is think about what we can do. So that's all I have.
That was perfect. Thank you. I'm gonna have to cry. Okay, anyways. What is it? So next we have Debbie. And thank you so much, Lori, for that amazing presentation. You've been able to do so much in so little time. I think that's why we're all just absolutely floored and amazed by you. So it's just a really good reminder that, you know, you started small and you've been able to accomplish so much. Anyway, so we'll switch over to Debbie Funata, and she has been able to do actually quite a lot in her role as well. And so, Debbie, please introduce yourself and then also tell us what you've been able to accomplish.
Great. Well, thank you for having me, Dr. Lalakele. That was very impressive. I'm going to take some of that to our team too, and maybe do a little pilot here at the clinic. So I am a medical administrative assistant here at the Arcata Community Health Center. We're part of the Open Door Community Health Centers. We have about a dozen different clinics throughout Humboldt County and Del Norte County. So North Country Clinic was the smaller clinic that I worked at back in 2004. And in 2017, I started a green team. We can go with the next slide. And this was actually something I wanted to do many years ago, because we had nothing in place that really promoted, you know, a sense of environmentalism from the clinic. And one of the doctors, our site administrator, myself, and a medical assistant said, yeah, let's do something. So we just went for it. I put out an email saying, hey, we're going to get together a green team. We're going to try to do some things, get some ideas going. We'll try things. And if you want to be a part of it, please join us. And so we had a working group of maybe about 7, 8 folks. We met every month, and we came up with a charter statement. And then we did a trash audit, looking at what was thrown away at the end of the day. And the custodian then was really into it as well. And he actually weighed all the trash every night for about, I think it was like 6 weeks at a time. And we did see a small decrease in the amount of trash after we implemented some of these changes. The first thing we did was reduce trash bag usage by eliminating some of the trash cans throughout the pods. This stack of trash cans is something we're proud of. This is what we recently got rid of throughout the clinic. We had about 48 trash cans in the clinic where just the providers, the nurses, and the medical assistants work in the pods. And we got rid of 36 of them, which means that every night, there's a lot less trash bag usage. So we did that. We set up a recycling system, which, as you know, takes a lot of somebody to really get things moving. We have to make sure someone empties the recycle bins and where they go. Our custodian now is really into it, so he contributes as well. And then educating staff about what is recyclable in our area. The plastic forks we got rid of, not entirely. We do use some compostable forks, which I don't like either, but we do use stainless forks and encourage people to have their own at their desk. Rechargeable batteries. The styrofoam boxes is a really horrible thing that I've been really trying to work on, and it's a constant battle because we get, I'd say on the average, about one of those big styrofoam boxes a month that comes with our medications. And in each box, there's about 7 or 8 of those coolant packs, the ice packs that are intended to just be thrown away, single use. Merck is the only company that I know of now that does returnable boxes. So I did do a little bit of a letter writing campaign, and I was really happy when Merck did that. I don't think it was because we did our letter writing campaign, but I'm trying to encourage other pharmaceutical companies to do the same. We set up a compost system here, which is great. Mostly it's the coffee grounds that get composted, but staff are slowly starting to use it more. We have eliminated plastic toys. We just give out stickers now. Our main purchaser is really into this and just purchasing toilet paper and paper towels with the high recycled content. Every week we have a newsletter that goes out to all the staff, and there's a green tip. So just kind of keeping education in the forefront. And the idea behind doing this back in 2021 was to share with other clinics. As I was saying, we have about a dozen other clinics within the Open Door system. And so that was our intention, is to list these recommendations and to share it with other clinics. So we can go to the next slide. In 2022, we did present this idea to the administration, and they loved it and said, yeah, let's spread it to the other clinics. And so we started the environmental advocacy group, which was part of all of Open Door, the whole Open Door system. And we got our healthcare environmental specialist. We have a garden resource person who was into it, the purchasing manager, some of the medical assistants, myself. And our intention was to get more of the clinics to do at least a green team, but that was a struggle. I think it's hard. I mean, we're all busy, and this tends to take a back seat, I think, because we have so many things in front of us. But as an administrative assistant, I'm able to kind of look at this and make it part of my job. And it's with my administration support that I'm able to do these things. So I think that's really important. We started with those list of accomplishments that I was talking about earlier, and especially working on the composting and recycling. But like I said, this group kind of faded out. And so now we're taking a break. But we can go to the next slide. Here at the Arcata Community Health Center, I just started a green team. And we have a good variety of folks on the team, including our custodian. And so that communication is really important. And now, so besides the composting and the recycling, the next project that we're going to be tackling is the invasive plants that are, there's across the clinic, there's a huge area of pampas grass that's been growing. And just within the 6 months that we started working here at this new clinic, it's become noticeably thicker. So I don't know if you're familiar with the pampas grass, but the heads bloom and then the seeds blow from there and it just spreads. And so I worked with the city of Arcata and the high school whose property it lies on, and they gave our team permission to go and clip those heads. So I'm going to make that a project, like a weekend where the green team can go out, and I'm going to invite the staff to go out with clippers and gloves and trash bags and at least, get rid of those seeds. It's at least something that we can do. But that's about it for now. I'm excited to continue with our team. And yeah, that's about it.
All right. Thank you so much, Debbie. So inspiring. And I think also very it's a familiar story where, sometimes there's a lot of wins and then there's a lull, right? There's like sometimes it gets really challenging. And so I'm really happy that you guys restarted. And yes, the pampas grass thing sounds like it's kind of fun. So you gotta send us pictures. It'll be good. All right. Yeah. So now we will switch over to Dr. Hillary Ong. Hillary, are you here? I just double
I'm
check.
here, sorry,
Okay,
I'm
cool.
here.
Yeah, okay, awesome.
Just turned off my video.
Okay. No.
Hi, everyone. Thanks, Shuin and Climate Health Now for inviting me to speak. So important, especially on a day like today, to lift up my spirits. But I am a physician in the pediatric emergency department at UCSF. And my talk was geared towards just like hyper focus on plastics, and wanted to give you all an example of current projects and waste reduction, and including plastic waste reduction. But didn't quite follow Shuin's instructions. And so I'm going to start off with just describing my journey into this world. And I'm happy to answer questions at the end, and sort of how the green team got together and lessons learned and etc. But I do want to highlight a couple of projects and initiatives. So I got pulled into the sustainability world and climate world in general during the pandemic, as I was just tapped on the shoulder during the pandemic in our pediatric emergency room in Washington, D.C. to find PPE. So that was sort of a trial by fire. In many interesting discussions and work into securing PPE. Can we recycle mask and sterilize mask, and just opening my eyes to just how wasteful we are, and especially in times of crisis, just highlighting the waste that we have in healthcare on a daily basis. So that's how I got started, and just by chance got introduced to Healthcare Without Harm back in 2019, and I've been sort of partnering with that organization and learning a lot from that organization, and doing a lot of sort of more global climate work and also healthcare sustainability work. Joined UCSF about 4 years ago now, and I remember my first day at work. I told my boss I wanted to look at our trash, and she was very befuddled. But I think coming to understand why more, as our institution is putting more effort into how we can reduce our waste, and more, I think, newer initiatives looking at reducing our plastic waste. So 2 years ago, started a green team in our San Francisco pediatric emergency department. They're somewhat expanded across our Department of EM, and now partnering with Oakland Children's Hospital, Talitha and Amanda, to sort of broaden like our sphere of influence in the sustainability world. So that's my journey. Happy to answer more questions later. So I'm going to be hyper-focused today on plastics and healthcare. It's a topic that I'm very deeply concerned about. Dr. Lauren, Lalakia, I know had highlighted a lot of facts. I'm going to skip through some of that. Oops. Oh, next slide, please. Oh, thanks. So as mentioned before, we're just wrapped in plastics. Like, you know it, I know it. Like every day we go to work, it's plastic wrappings, plastic material, and everything, not everything, a lot of equipment and materials we use now, it's just single-use plastics. Next slide, please. So some of these facts that Dr. Lalakia had mentioned, like highlighting that more than 90% of our medical plastic waste is not recycled. So recycling is really should not be sort of a key initiative, but reducing, refusing, and repurposing perhaps should. So using that framework of the 4 Rs. Next slide, please. One of the more comprehensive like studies I've looked at is really from Healthcare Without Harm in Europe, and they looked at a handful of hospitals across Europe and found that about 50% of their hospital waste is plastic based, and the top offenders are gloves, so nappies they call it, or diapers, IV bags, etc. So I think we can lean on this data. We don't have such comprehensive data yet in the US to sort of focus on our sustainability quality improvement initiatives. Next slide, please. And I'm going to mention really briefly why this is important, is this concept of do no harm. So most of these are single-use plastics. It gets thrown in the trash, it gets thrown in landfill, or our regulated medical waste gets incinerated, or with poor waste management, it leaks into our waterways. And plastics never decompose. They just, they're just degradable, meaning that they just become smaller and smaller plastics to microplastics and nanoplastics. And because these are fossil fuel based, like these plastics continue to leak like chemical pollutants. The most famous is PPA. PFAS, or the forever chemical, is a lot, in our news stream. And a lot of phthalates and different products that cause potential like health harms. So that's why the direct impact of health impact of plastics is something we need to pay attention to. And when we burn plastics, it also creates microplastics and other flame retardants, heavy metals gets into the air that we breathe. Next slide, please. Oh, 5 minutes. Okay, I'm going to check through this. So I think something we don't often think about is direct patient exposure to plastics in the healthcare setting. There's some biochemical studies that talked about just wear and tear of the plastic material we use in healthcare, but the studies need to be done to really link that exposure through healthcare plastics to direct health harms, and it's really a dearth of studies. I'm going to skip forward. A lot of studies are from the NICU, and the slide before I had highlighted that this is one of the most direct links, in that if you remove DHP from IV fluids from really premature neonates, they get less hypertensive. And this is a 7-year review study. And when they put back DEHP in their IV fluids, these tiny little neonates get hypertensive. So definitely a direct link to health harm from healthcare plastic exposure. Next slide. Next slide. Okay. So published viewpoint in JAMA sort of to highlight just 7 strategies how we can reduce plastics in healthcare. And next slide. Sorry, don't have much time left, but these are the 7 strategies I had proposed, which is a socio-technical logical approach. Next slide, please. I'm happy to share these slides at the end. But sort of our clinician-based approach and how we can, as clinicians, be more involved, I think really first off is doing a landscape like analysis. So addressing what type of plastics we can use. We're never going to get rid of plastic. So what are the ones that causes health harms? What can we take out of our supply chain more immediately? Really addressing those low hanging fruit. Reducing like our use, and that leads to reducing our waste, and thinking about going retro. So going back to the old school metal bins, metal trays, glass bottles, perhaps to reduce our single-use plastics. And there are a lot of like new materials out there, like bioplastic free materials. And there's a new study from Yale to suggest that 50% of these like new plastic free materials are actually containing fossil fuel plastic chemicals. So I think we need to be very careful when considering alternative to bio like plastics. We need like a third party sort of LCA to really be more data-driven approach when we consider these alternatives. And we have to voice our demands. We have to refuse to use DEHP IV fluids because like there are studies to support that it causes patient health harm. So our voice is really important. I'm going to highlight lastly, just so I can slip forward, forward. Yeah, I click forward. And this is the elaceration repair procedural waste study that I just wrapped up and hopefully will be pushed for publication soon. So I work in the pediatric emergency department, and I do a lot of laceration repairs. So these toddlers kind of toddler around, trip and fall and hit their forehead, and they come into the emergency room and I need to suture their laceration. And this is me opening our laceration repair kit. And as you can see, it's wrapped in layers of plastics. I don't know why my instruments are in a styrofoam pocket and a plastic tray, etc. And out of the 36 items that I use in there, I maybe routinely use 2 things: scissors, needle drivers, and I toss the rest. So I chose this project because every time I open one, it really annoys me and angers me. So I did a study out of it. Next slide, please. That we audited our providers, and 100% of our providers open this kit. No surprise there, because there's no alternative to finding a pair of single-use individual wrap like scissors or needle drivers. And when we did the waste audit, similar practice to myself, where my colleagues also unused and completely untouched. Like 70% of the items in there are completely untouched or just thrown away because they're a single use. And so when I asked folks, so what do you really need? Everybody, like not everybody, but most people mention I just need scissors and forceps. So when we compared like our current practice to what are the ideal practices, there's a potential that we could reduce waste by 60% and reduce CO2 emissions by 50%. And this is sort of yes, it took effort to do as a research project, but this is a small drop in the bucket in the grand scheme of things, but a huge impact. And that's why historically, that's why I think clinicians, and it's so important in sort of closing the gap between hospital leadership and strategic purchasing and supply chain, because those folks are trying to do good, but they're just fed with stuff that's presented to them from the medical suppliers, and there has not been any clinician input. So I know I'm like so out of time, so I'll stop there, but happy to answer questions.
Thank you so much, Hillary. No, I know you had a lot. I was like, oh,
I
this
had a
is
lot. Yeah.
yeah.
Sorry.
But actually, if I'm gonna just stop sharing for really quick. And Bill, could you lead us in a little bit of a panel discussion with our three speakers before we open it up for Q&A?
I would be happy to. The first question that I actually see is from Amanda. And Amanda, I don't know if you want to come off mute and ask your question.
Sure. Oh, I'm honored to. Yeah, my question. So my Talitha, who's on the call, and Hillary and I, and somebody who's not on the call, are part of a effort right now to that we're calling Gowns and Gloves to decrease glove use at our children's hospitals and increase reusable gown use. And my question is, how do you make the leap? Like, we're working to understand what the hospital is actually purchasing right now, but how do you translate that into any estimate about CO2 reduction? Like, how would you even go about doing that?
Through an LCA is the best way, but for my gloves project, you can look for published information about the impact of various products, and that's how I did the multiplication for gloves, because there are publications well done that indicate a carbon footprint for a single nitrile glove being 26 grams of CO2e. Between that and about 32, there's a website called Healthcare LCA that takes a little bit to use it, but it's basically cataloged all the LCAs done in the healthcare space, and you can toggle in, what you're interested in looking at, and whether that's, a glove or a drape sheet, and it'll give you link outs to those articles, and then you can decide, does it apply to me or not? Like, all right, well, this one was done in Malaysia, and I don't know that that's going to really be applicable. Or, yeah, the one I chose, it was a study in the UK, but they source their gloves from Malaysia and one other place, but those are the same places that my gloves come from, and they had to travel farther to get to me. And so I felt like, okay, it's comfortable to say that we're in this range. But Hillary, I'm sure you will have some additional input on that. I'm kind of a novice at that.
No, definitely on the same page. Healthcare LCA is a great resource, and there's more and more like LCAs like out there, but I think more focused on the OR and anesthesia, for example, and they're like long and lengthy studies, and it takes a lot of effort to be able to get an LCA out in our medical community. M-Waste Calculator is a free calculator out there that folks can use to just plug in the various products and do an estimation of where your healthcare products set hold to. So that's another resource, M-Waste Calculator. There
M
are
as in just the letter, the
yes,
letter M? Waste calculator.
Yeah.
Is that from Mazzetti? Is that right? I think that's a Mazzetti source.
I think it's a Massetti, yeah.
Yeah. Okay.
I haven't looked at it in a while.
Okay.
And there are other calculators or databases like for purchase, and I think they range from hundreds to thousands of dollars. I'm like forgetting the names of those, but there are like databases out there that for purchases that we can look into to similarly to sort of plug in the materials we're interested in and find an estimation of the weight and like carbon footprint associated with it.
I would just like to add that for things like reducing plastics, the carbon dioxide aspect is only a small aspect of it. There are many more toxic chemicals in those items. So yeah, it's good to look at the carbon, but that can be a distractor and certainly is not the whole answer. So getting plastics out of your practice has benefits well beyond just the carbon aspect.
That's
much bigger.
That's a great point, Bill.
And
Yeah, that's a great point, Bill.
Yeah, and there's a small but growing body of evidence of what microplastics and nanoplastics are doing to our health. And the additives in plastics like the DHP, which many are endocrine activators and have been suggested to have lots of toxic effects. So there's much more to the plastic story than carbon dioxide. Wendy, you had a question. Do you want to come off mute and ask your question, please?
Sure. I was just curious if any of you have found funding sources for your projects, and just thinking about like even like, you know, printing posters for you know, how to decide whether or not to wear gloves. Like no one wants to pay for that, you know, and just you know, that this can be such a challenge. The it kind of seems like like in my experience, the only time you really can get something done is when like some new law passes and they have to do it. So you know, just being able to sort of dangle that little carrot of like, well, you know, we got a grant from Pfizer to do this facility-wide education about plastic use or something like that, could kind of move things forward. But I just haven't really seen those kind of sources. If I was rich, I would fund those.
I have had no funding. It's all been grassroots, which generally means, you know, in lunch breaks and, you know, like if people do have a little bit of administrative time blocked into their week. So we're always deep underwater in terms of funding at our county hospital, and it's not just money, it's also just sort of the human resource aspect. People are already doing way too many things. Yeah, so it's hard.
I agree completely. And I would add that like you just have to find that one ally, one friend or two allies to get the momentum going. And I started off with as a passion project. The laceration repair project was not funded. I was hopeful that there would be funding streams coming from up top. So the current administration, the Biden administration, had put out a call to action on the plastic crisis in July. How that's going to move forward, if that's going to move forward at all, probably not. I don't want to be grim now, but I'm a little bit grim today. I think depending on leadership and JCAHO, this is going to be an issue that needs to be addressed regardless of administration. And so getting funding might be more difficult going forward, but I'm hopeful there's going to be some pennies on the ground that can help our effort.
Sort of the second part of my question is, you know, if you do a study, does that help? You know, does that make people think, oh, well, now it's research, so now you can apply for a grant? And then when you mentioned JCAHO, I'm like, well, maybe that's the place to do, is to be lobbying.
I mean, JCAHO now has a voluntary sustainability certificate that facilities can apply for. And there have been a handful of facilities that have done that work. JCAHO has a resource center about sustainability. I think, you know, they've now drunk some of the Kool-Aid about this. They say that they have scrubbed their regulations so that they are more environmentally friendly. I think
we'll see.
We'll see. Yeah, we'll see how that all goes.
I think all hands on deck. We need to push JCAHO. We need to push the regulatory bodies. We need research. I see this work as being under two umbrellas, and I'm like in the academic umbrella. So I think research funding, it's there. Perhaps sustainability QI or quality improvement in terms of patient safety. There's like some money there. So perhaps these two buckets, but unfortunately, I don't think there's a separate bucket for just healthcare sustainability at this point.
I'm sorry, Wendy, there are a couple models that have been used at facilities. A number of facilities have developed a revolving green fund. So fortunately, many times when you use fewer resources, when you save energy, when you become more efficient, you save some money. And some institutions are allowing monetary value to be put on that, and that money then is banked and used as the capital outlay for the next project that hopefully will have a positive return on investment to refund that revolving fund. So that has been done at several institutions. The most interesting funding process that I've seen has been at the University of Kentucky for about 20 years. And they actually charge a less than 1% fee on every disposal, every item that's purchased throughout their campuses. The undergraduate, the university campus and the health campus are all combined. Any item that's going to expect to be thrown away within a year gets charged a fee of less than 1%. And that pays for waste management, environmental health and safety, surplus management, and sustainability. And that has been a self-funding mechanism for decades. I think it's a fascinating project. I'm not aware of anybody else who's doing that. I tried to float that through my own institution, UC Davis, and they did not bite. But just a couple examples, but the revolving accounts are done at several institutions. And Ashley, you got a hand up. I'm still muted though.
There.
Ashley.
There. Is there a place to look for examples of business cases that have shown the savings for different healthcare sustainability projects that we can like a shared repository where you could get ideas and see what money has been saved to pitch these ideas?
Practice Green Health has some resources along those lines about making the case to leadership, where they will have examples from member facilities. And I've screenshotted some of that stuff into slides that I've used in the past.
And I can share some examples of analyses we've done in our own institution where we've saved tens to hundreds of thousands of dollars on projects. Unfortunately, we could not get our institution to establish a green revolving fund, but even though we got a rebate from our electrical company and they said they were going to let us use it for sustainability, that got taken away as well. So it's a little tricky to pull off.
And I would add like the cost savings argument, and that calculation is really important. So how I'm able to move forward with the LAC repair waste reduction project is that my plan is to substitute what our current kits with just individual like instruments. My goal is to like actually have instruments like a plastic surgery tray that's reprocessable and reusable in our emergency department, but that is a whole different workflow. And it's cheaper to have the single instruments that are single use and disposable than the whole tray. And it's more expensive to have reprocessable single use instruments. And so I had to just negotiate like, with our strategic purchasing people and with our leadership that like, okay, it's good for the environment, it's good for the pocketbook. So let's go forward with this plan. And that's how I got the green light. I think if it's like good for the environment, but like higher costs, I don't think I would have gotten a green light.
Well, we're at time, Schwinn.
Yes, we are. So, Bill, I don't know if you want to do a little pitch for your healthcare sustainability fellowship.
Well, sure. So we are still accepting final applications for healthcare sustainability fellowship through CHN. So we have a team of coaches who help individuals or teams who want to develop a sustainability project in their own institution. We do have a small amount of funding that is involved with this fellowship, although that's primarily to attend our annual meeting to present our progress of our fellows. But again, if you're interested in applying for this fellowship, you can get in touch with Ashley or Amanda or Schwinn or Margie or Brenda or me or Pam Lee, and we can get you the application.
All right. Thank you. I think this is a really great opportunity to, if you've been kind of feeling really fired up, you're like, oh, I want to try one of these at my, healthcare organization or something similar. We have amazing experience within CHN. And so, yeah. So I hope that you all feel like you can do a little bit more on this very sad day. And be well, everybody. Take care of yourselves. Take care of your families, and yeah.
Thanks,
Hope you have-
Joanne.
Thank
Thanks,
you.
Everybody, thanks to
Thank
our
you.
speakers
Bye.
too.
Yeah.
We'll
Thank you.
send
Bye.
stuff out. Okay, take
Yes.
good care.
Thank you, presenters.
Bye, everyone.